Hello, everyone. Thank you for joining us for yet another session of Facebook Live Chat with an Expert. We have been hosting these sessions on the third Tuesday of every month to discuss dementia-related topics that are relevant for caregivers. My name is Padma, and I'm a learning specialist with the Alzheimer Society of Calgary. Today, I'm very pleased to have with us Dr. Dallas Seitz, Clinical Associate Professor of Psychiatry with the Cummings School of Medicine at University of Calgary. Prior to joining University of Calgary, Dr. Seitz was an Associate Professor of Psychiatry at Queen's University and Chair of the Division of Geriatric Psychiatry at Queen's. He was also the President of the Canadian Academy of Geriatric Psychiatry. Dr. Seitz has a clinical interest in dementia, neuropsychiatric symptoms of dementia, and late onset mood disorders. His research interests include knowledge translation in geriatric mental health, evaluation of the safety and efficacy of psychiatric medications for older adults, and health services research related to geriatric mental health conditions. Dr. Seitz was actively involved in policy and advocacy work in Ontario and was the provincial medical lead for capacity planning in Ontario. The topic we have chosen for today is lifestyle approaches for preventing and treating dementia. Dr. Seitz has been having some computer issues today, so we will not be able to see him. However, he would be presenting his slides and answering our questions. So we invite you to ask questions for Dr. Seitz in the comment section of the video when you watch it, and we will get to those questions at a later period of time. And considering the public nature of Facebook, we request you to avoid personal questions and to keep your questions general. So let me begin this chat by first of all welcoming Dr. Seitz. So good morning and welcome to this chat, Dr. Seitz.
Great. Well, thanks for the invitation, Padma.
Welcome.
Great. So I'll start my slides here if that's okay, and then I'll stop them. I have a maybe about 20-minute presentation, and then we'll get to our chat portion.
Good.
You can see my slides okay there?
Yes. Yeah. All
Great.
good. Yeah.
Thank you. Well, thanks for the opportunity to present. And this is an area that I'm interested in for a number of reasons. This often kind of comes up in my visits with patients and caregivers about sort of what can they do to prevent dementia, or maybe to slow the rate of progression of dementia. And I also think this is an area that is really rapidly expanding in terms of our research and evidence base. So it's a great opportunity to present here. So maybe just to start it off, in terms of lifestyle approaches to reducing dementia, what's been sort of acknowledged recently is that up to 40% of dementia cases may actually be preventable. And so this is really good news, I would say, in terms of our understanding, and probably one of the most effective ways we can address dementia is to try and prevent or delay the onset of dementia. And what we also know now is actually that the incidence of dementia is now declining compared to previous generations. So what that means is that at any given sort of age, people now are less likely to develop dementia compared to a generation ago. And the reason why dementia is, the risk of developing dementia is going down in our population is because dementia risk factors and these lifestyle related risk factors are less common now than they used to be a generation or two ago. So this is, I think, is really encouraging news. And we're seeing this across several countries and different regions in the world, that dementia is actually, the risk of dementia is going down. So I'm going to talk a little bit about risk factors for cognitive decline, which may or may not reach the kind of threshold for dementia or Alzheimer's disease, and then also risk factors for dementia. And many of the risk factors and approaches to sort of prevent decline in cognition and dementia are similar, but sometimes there might be a little bit of a difference. So I might sort of change a little bit between talking about cognitive decline or mild cognitive impairment and dementia, but really there's more commonalities between the approaches for cognitive decline and dementia rather than big differences. So, for example, some of the things that we know increase the risk of dementia, of cognitive decline, are things like brain injuries, obesity, high blood pressure, smoking, diabetes, depression, sleep problems. And some of the things that are protective against cognitive decline are things like education, physical activity, things like Mediterranean diet, cognitive impairment, and social engagement. Similarly, if we look at dementia risk factors, it's very similar. So things that increase the risk: obesity, brain injury, smoking, and things that decrease the risk of developing dementia: education, activity, diet, and cognitive training. So I'm going to focus in on these as we go through the presentation today and talk a little bit more about some of the evidence, and also areas where we don't have good evidence, or we have evidence that certain things don't seem to affect dementia risk. This is actually from the Alzheimer Society of Canada, or I apologize, from the OECD report on dementia prevention. And they look at things that are behavioral risk factors. So these are things that we have some control over, things like smoking, activity, and diet. Then there's medical conditions, which some of which can be prevented, but also some of which, depending on how well they're managed, that can impact on dementia. And then there's also some characteristics, things that are unmodifiable. So genetics, for example, you can't change your genetics or your family history or your age. However, when and whether someone develops dementia, even with a strong genetic component, these lifestyle factors will alter, how quickly someone may develop dementia or whether they might develop dementia. So there is, even for the things that are unmodifiable, the modifiable risk factors kind of can add to or speed up the development of dementia or increase the risk on top of these modifiable risk factors. And in terms of whether dementia can be prevented, I think we can say that, yes, not in all cases, but in a number of cases, we can prevent dementia or slow its decline. And some of the ways that we can sort of prevent dementia, or this might work, is there are some conditions like high blood pressure or brain injury, for example, that can directly lead to changes in the brain that are associated with Alzheimer's. And then there's also other things like exercise, education, social contact, which increase cognitive reserve, or your brain's ability really to compensate for changes in the brain that might occur, or maybe early signs of dementia. So it's both sort of increasing cognitive reserve and decreasing some of the brain changes associated with dementia. So in terms of some of the approaches that are used to prevent dementia, from a population standpoint or public health standpoint, the recommendations from the Lancet Commission are to do things like increase education. So that's probably number one from a population standpoint. If we increase people's level of education, it does protect against dementia. To reduce hypertension in the policy or high blood pressure, that may be through things like you see, like reducing the salt content of food. To develop policies to encourage physical, cognitive, and social activities. A big one that's been acknowledged now is hearing loss. And so this can include hearing protection, but also increasing supports and services for hearing loss, reducing brain trauma, it might be through accidents or falls, air pollution, which is associated with dementia, and also to encourage a reduction in smoking, because we know that that has direct effects on the brain, but also is associated with things like heart disease, which we know are dementia risk factors. And then on the individual approach, things that you might be able to do for your health, or kind of having a discussion with your family doctor or healthcare provider, treating high blood pressure, to try and minimize the risk that can have on the brain, using hearing aids for hearing loss, and again, protecting hearing from damage. Really trying to minimize alcohol consumption, particularly heavy alcohol consumption. Along with that, stopping smoking, preventing head trauma where someone's at risk. So things like seat belts, helmets, sporting activities, reducing obesity and the risk of diabetes through a combination of diet and activity. And probably most importantly is really to try and sustain and promote physical activity. That's probably, I would say, number one in terms of things that people could do themselves to prevent the onset of dementia or try to minimize the progression of dementia, is really try and get physical activity. In Canada, we recently completed some updated guidelines on dementia. And one of the topics was around reducing the risk of dementia. And our guidelines, similar to other recommendations, have been to recommend Mediterranean diet. And I'll talk a little bit more about that. Low in saturated fat and high in fruits and vegetables. Again, moderate physical exercise, including both aerobic exercise and strength training for both dementia and cognitive impairment, hearing loss. Sleep is one that comes up quite a bit in terms of questions. So it's really recommended to both make sure that you treat sleep disorders if those are present, things like sleep apnea, but also to reduce chronic sleep deprivation. We know that people who do not get enough sleep, and it's typically recommended 7 to 8 hours on average, that can have a toxic effect on the brain, and it's stressful. Our guidelines also recommend cognitive training and stimulating activities, social engagement, and early life education, to avoid substances and medications which can impair cognition. So this can sometimes include medications that are sometimes used for things like sleep, for example, or strong painkillers, if they're not necessary. And then to also assess and treat high blood pressure and stroke to prevent the complications related to this. And in terms of interventions for people who may have dementia, if exercise and cognitively stimulating activities are recommended, even if dementia has developed, because it can alter the speed at which dementia develops, and also, especially things like exercise, can help maintain functioning in other aspects of health, which are important. And it's also recommended that all healthcare providers really now do provide some lifestyle and health counseling for people with dementia, which is something I think we're increasingly doing in our programs now to try and really recommend these things, knowing that they do have a good evidence base. And the World Health Organization also developed guidelines on risk reduction and prevention of dementia. I won't go through them, but again, very similar recommendations that our Canadian guidelines and other organizations have recommended in terms of areas where we have really good evidence for preventing cognitive decline and dementia. So in terms of dietary interventions, as I mentioned, a Mediterranean-like diet might be recommended really for people who have mild cognitive impairment or to reduce the risk of dementia. And a healthy, balanced diet should be recommended to all adults, even without dementia. This is a good thing to follow. There really isn't any evidence for supplements with certain vitamins, things like vitamin B, E, fatty acids, multivitamins. These are not recommended at this time. Most of them are harmless in the dosages that are commonly available over the counter, but most of them have also been studied and not been shown to have a benefit in preventing dementia, unless someone is deficient in a vitamin. For example, vitamin B12, a lot of people take that supplementation because they're low on vitamin B12, and that's appropriate if you have a low level. But taking a vitamin, if you are not deficient or low in the vitamin, doesn't seem to help prevent dementia. There's also a bit of evidence that's developing for a ketogenic diet. So these are diets that are typically high in specific types of fats, don't use a lot of carbohydrates. Much harder, I would say, to follow in general than a Mediterranean diet. But this is an area that is being looked at. And the idea with this, I think, is that in Alzheimer's disease or certain forms of dementia, the brain's ability to use blood sugar as a fuel can be affected. And so looking at increasing all alternative sources of body fuel, which can include keto fatty acids, may sort of provide the brain with alternative fuel sources, which might be help. But again, this is an area that needs more research, but is being looked at. There are some really good resources. I like this one, which was, I believe it came out of Baycrest.
Baycrest, yes.
Yeah, the Brain Health Food Guide. So if you Google that one, Brain Health Food Guide, this pops up and it really gives you the best evidence, I would say, in a pretty easy format about what kind of foods to concentrate on and which ones you may want to try and be having less in your diet. Exercise programs, really exercise is recommended for people to prevent dementia, people who may have mild cognitive impairment, and people who might have dementia. And while getting any exercise is better than getting none, really a variety of exercise seems to be most effective. So that includes aerobic, something that gets your heart rate up, resistance training. So that would be some strength training, and then things that work on balance. So it might be things like yoga or Tai Chi, those types of activities that tend to work on balance, and sort of a variety of exercises seem to be good. Much like stimulating your brain with a variety of cognitive tasks, stimulating your body with a variety of exercises seems to be good. And I would also say all of these things are pretty important for healthy aging. Having strength, aerobic exercise, and balance, particularly to prevent falls, is important. And there's evidence in all groups, people kind of preventing cognitive decline with mild cognitive impairment and people with dementia for exercise. And this is really one of the areas where we have the strongest evidence. Cognitive training can be offered to older adults with normal cognition. There are some small to moderate effects of cognitive training, and they can have some lasting benefits in the short term after doing some of these exercises. Although, truthfully, most of these activities, you have to keep with it to keep realizing the benefits of it. So if you stop doing the exercises, after a period, you'll lose some of the benefits. I'm not recommending a specific activity or program. I think really anything that's enjoyable and cognitively stimulating that you have access to is probably going to be helpful. And also to be aware that, there are some programs and things out there who in the past have advertised as being great at preventing dementia or cognitive impairment. And some of those programs have actually been sued because they didn't really have the evidence to back up the claims. And so, just to be cautious about that, because people know this is a big area that people are very interested in. But I would be cautious about recommending any specific program. And Lumosity, which I think is a very interesting program, they actually got sort of in trouble for kind of stretching, at that time, stretching the claims for their evidence. And while each of these components, like diet and exercise and cognitive training, seem to have some benefits on their own, I think where the research is really going is looking at sort of a package of all of these approaches. And certainly I would say if you can have a healthy diet, physically active, and do some cognitively stimulating activities all together, or some of those all together, that's probably more effective than just doing one. The largest study that's been done related to this is called the FINGER trial, or the FINGER study, which is the Finnish intervention to prevent cognitive impairment. But there's a whole bunch of other studies looking at this. And just to give you an idea of the FINGER study, it was conducted at 6 locations in Finland. And they took people sort of between the age of 60 to 77 years who were at increased risk of developing dementia because of risk factors, but did not have dementia. And what they provided to them was a package of dietary advice, some exercises, cognitive training, and then trying to also work with their family physicians to reduce risk factors like blood pressure and diabetes. And what they found with this study is this package of activities was associated with improvement in cognition, improvements in weight and physical activities. So it's very positive. And actually, while it sounds like a very busy intervention, they were able to get people to do 80% of all the activities recommended. So people were pretty motivated, to participate in the program. The last thing I wanted to talk a little bit about were the things like outdoor activities and nature and well-being, because this is an area I'm quite interested in, and I think an area where we're going to see more evidence developing here as well. So we know that older adults who live in neighborhoods who have greater access to things like parks, they're less likely to report difficulties with depression and anxiety. And outdoor activities like gardening have also been shown to improve depression, quality of life, and loneliness compared to other conditions. And also that nature-based activities, including things like gardening or participating in outdoor activities, have been shown to be associated with some improvements in cognition in older adults. And so part of this may be through things like exercise and social activities, but there may actually be some specific benefits associated with nature, where it's been shown that being in an outdoor environment can have a calming effect or can help restore attention for a lot of people. And so there may be some specific effects of being outdoors, or at least exposed to natural environment, that might be helpful. And when we look at nature activities in dementia, which is an area I'm interested in, we again know things like gardening in particular. So that could just be spending time outdoors in your yard. Also, some improvements in daily activities and motivation to engage in activities when people spend time outdoors. There's interest in things like having more dementia-specific programs through adult day services. I think UQuest in Calgary is a great example where they try to engage in outdoor activities, but also some other areas like in Scandinavia where they're starting to have day programs that are actually part of farms, or where people participate in safe, farming activies or farm-related activities, like spending time with animals, doing gardening, those sorts of things. I think that's a very interesting idea. And I certainly have a lot of folks I see here in Calgary who come from different backgrounds, but there's definitely a lot of retired farmers, in southern Alberta, where these were very meaningful activities for them.
Yes.
and quite enjoyable. And when they've spoken to people who have dementia and have been engaged in outdoor activities, they said that having the opportunity to continue to participate in outdoor activities was meaningful. It was empowering because it gave them a sense that they have some control over things. It allowed them to take a little bit of risk, because being outdoors, there may be some risk of wandering or maybe tripping or those sorts of things. They're not completely without risk, but that was positive, and to feel that they were challenged. And then for a lot of people, this was an important part of their life growing up, and so this was a way for them to reconnect with their identity. So I think this is something we probably really need to think about more. And we're working here in Calgary to do some work with our City of Calgary and Alberta parks, but some programs in Australia and the UK have really started to look at how parks and outdoor spaces could be more dementia friendly. And I think this is really important, because there are some important considerations for people who are older adults, and particularly those who might have cognitive problems, to make outdoor spaces accessible and safe. And so we're starting to do some of that work. And just a little bit about nature and nursing homes too. This is a picture of a dog named Hudson. His name was Doc Hudson, who I worked with when I was in Ontario. And he used to come to our dementia unit in Belleville. And it was such a pleasure. I liked visiting with Doc. You can see he's got his own little staff badge on his collar. But the people on our dementia care unit really benefited when Hudson came around. And there is actually pretty good evidence for things like animal-assisted therapy or sort of pet therapy, improving quality of life, and also having access to gardening, either indoors or through kind of courtyard spaces in nursing homes that can really be helpful for people. And just before we wrap up, I'd really be interested in hearing from people at some point, through the chat or Facebook, about your thoughts on the outdoors and nature as part of a healthy lifestyle. And so if you have any information you'd like to share with us about how you try and make the outdoors and nature part of your healthy lifestyle, what are some of the factors that maybe you consider where you spend time outdoors, whether that's in your yard or local parks or places that you travel to? And if there are certain facilities or features of parks or outdoor spaces that you find are important for you, that make you feel safe or supported, or that this is makes it easier for you to access, we welcome your comments and thoughts on this. As I said, we're just kind of launching into this area of research, and so I really appreciate any feedback or thoughts that people have about this. And just to wrap up here, there's some other resources for dementia risk factors and prevention of dementia. If you Google these, dementia risk factors or heads up for healthier brains, reducing your risk of dementia, these are all available on the website. And they're actually really good resources about how can I get started with physical activity or diet, or what are some stimulating activities I can do at home to stimulate cognition. So these are some great resources. The first two there are from Canada. Great. So I think that's probably it. I'll stop sharing my screen. And
thank you. That was a very informative presentation and lots of resources and lots of great new ideas, especially about the outdoor activities that you mentioned. And that's a good time to launch such a program, because we are having nice warm weather here. So that's great. So do we have some time for questions, I guess? Right, we do have about 10 minutes. But let's see what we can cover in that time. You mentioned a little bit about all the lifestyle strategies, lots about lifestyle strategies. So in your opinion, what would be the 5 top strategies that you would recommend to people that would enable them to reduce their risk of dementia, or if someone has early dementia, to help them slow down the progression of dementia?
Yeah, so I think that, my top 3 are always going to be, I would say, diet, exercise, and cognitive activity.
Mm-hmm.
And then I think, beyond that, probably, reducing smoking for
Mm-hmm.
people who might be smoking, and then ensuring that blood pressure is managed well. So these are all things that contribute fairly strongly to the overall risk of dementia.
Mm-hmm.
But for an individual, it kind of depends on which risk factors they have or don't have.
Mm-hmm.
But in general, those would be the big ones. But for some people, the bigger issue might be hearing impairment, for example, if they don't have any of the other risk factors.
Mm-hmm. Yeah, great, thank you. And these, I believe that, in your opinion, these are going to be the most effective. These are the most effective lifestyle approaches, right?
Yeah, these ones I would say, have the most consistent evidence. Yeah.
Okay.
And they're pretty, I would say they're also pretty harmless. Like there's not much risk to any of these. Yeah.
Yeah. Naturally, people might have this question, would these lifestyle strategies help mitigate the risk associated with genetic mutations, some defective genes that they have inherited from their parents?
Yeah, in general, there's sort of genetics sort of increase your baseline risk. For most people, it increases your risk of developing dementia in the future. And then there's things on top of that that can further add to that risk, which might, for some individuals, might mean that you develop dementia earlier, or you may develop, even with genetic risk factors, you may never develop dementia without additional risk factors. So I think it's really focusing on the things that you can modify, which will either delay the onset or may prevent it, depending on the type of dementia.
Yeah. And definitely it will improve a person's general health as well, right?
Absolutely. And quality of life. Absolutely.
Okay. We normally talk about lifestyle strategies when it comes to Alzheimer's disease and vascular dementia. But is there any research evidence that points to their benefit in reducing the risk or slowing down the progression of FTD, frontotemporal dementia, or Lewy body dementia?
Yeah, I honestly, I don't know specific information about that. I would say with Lewy body dementia, often dementias, there's overlap and more than one contributor. So I wouldn't, and so a lot of people with Lewy body dementia also probably have some degree of Alzheimer's disease, and vice versa. And so I would anticipate that those factors would probably help reduce that risk as well. Frontotemporal dementia, again, I would say we have less information, but it would make sense to me that it would probably help to delay the onset for some individuals, and certainly, if nothing else, would probably help with quality of life, functional impairment, general
reduce all
health.
other costs of cognitive impairment, right? It helps them to avoid all other precipitating or risk factors for other causes of cognitive impairment by engaging in healthy lifestyle.
Absolutely, yeah.
Okay, yeah. So these strategies, approaches that you mentioned, they also are useful in slowing down the progression, right? But do they have a role in curing? And I know that we don't have any drugs for curing, but I'm just asking, would they be helpful in in modifying that, or let's say reducing the severity of dementia?
Yeah, I think probably, in some cases, there may be some cases where some of these factors have a very big impact. Like I think of things like diet. There may be some individuals, for example, whose diet leads to like a vitamin deficiency. And if you correct that, the cognitive impairment may actually go away. That's not that common. Or some of the other things like medications or substances, where some people can have significant cognitive impairment and have a dementia that maybe isn't Alzheimer's, but when you stop the alcohol use or the medications, that they actually have a reversal in cognition. But I think for most, in most instances, it will help sort of slow the rate of decline, rather than reversing things completely. And probably most of these interventions are most effective, truthfully, if people start them in their 40s and 50s, rather than after cognitive symptoms have developed. Still beneficial if people already are diagnosed, but probably most effective in midlife.
So you mentioned about some evidence for ketogenic diet. I happened to read something very recently about intermittent fasting too, having some evidence of improving short-term memory as well as long-term memory. So I'm just kind of fascinated with that, because what they claimed was that it regulates the glucose levels or energy balance in the brain. So have you heard of anything like that?
Yeah, I think this is an interesting area. There's I think a lot of research going on the role of your body's insulin, blood sugar, and how that affects and is impacted on the brain. So, and again, that may be one of the ways that exercise actually improves the brain, is because we know exercise makes your body much better able to use glucose. It increases its sensitivity to the insulin that's in the body. So I think it's a very interesting area. I would say it's pretty tough to do intermittent fasting, or even to some of the low carbohydrate diets like kind of South Beach or Atkins. They're hard to do, even if they work, but they're hard to do, and they don't feel very good. Like if you've ever done them, you kind of feel rotten for the first few days,
because you get used to it.
Until you get used to it. So I think a Mediterranean diet is, it's a little bit easier to kind of manage as well.
Combined with exercise and all the other lifestyle approaches that you mentioned, that would be an easier approach to take.
Yeah, absolutely.
Yeah, thank you. So we often hear about this gut-brain connection. So especially in regards to Alzheimer's disease and Parkinson's, I've been reading more about that. So what are your thoughts in that regard?
It's a very interesting area. My department head, Dr. Taylor, is like a world expert on what's called the microbiome, which is like your gut bacteria and how that affects mental health. And so we've just been starting to have some conversations about its role in dementia, because we know that diet, medical conditions, things like antibiotics, can affect your gut and the bacteria in your gut, and the type of bacteria you have in your gut can have an impact on mood. And there's some preliminary evidence suggesting that there might be a bigger role than we might have initially thought about how your gut health could impact on brain health and risk of dementia. So it's an early area, but it's actually looking like something that maybe isn't as far-fetched as it first sounds, that there might be a gut-brain relationship, and maybe some potential treatments down the road that target the gut and the microbiome. So very interesting area.
Yeah, there's a drug that's been conditionally approved in China, or oligomanit, And the mechanism is supposed to be the same way, like altering the gut bacteria, reducing the release of inflammatory lymphokines from the gut by altering the gut bacteria and thereby reducing the inflammation in the brain. And that is a kind of mechanism, but I think the studies are going on, the rest, phase 3 studies are going on in the rest of the world, including Canada, I believe. Yeah. So I do have more questions, but then we have taken 2 more extra minutes. So I do not want to, I know how busy you are, Dr. Seitz, so I do not want to keep you waiting. Maybe those questions will be for another occasion. But thank you so much for spending this time with us, sharing your expertise and your valuable time with us. And even though you had some computer issues and we couldn't see you, you were very audible, very clear, and your slides are just so full of information. So thank you so much for that. So a big thank you from all of us at the Alzheimer Society of Calgary. And as always, it has been a great pleasure to chat with you this morning. And thank you for all of us, all of you who are watching this video. Please join us next month. That's on July 20th. Yeah, July 20, at the same time, for a chat with Dr. Gudarsi on the topic of depression in dementia. And in the meantime, if you have any questions, please feel free to call us at 403-290-0110 to speak to a social worker one-on-one, or send us an email if you have any questions or your opinion. And also, as Dr. Seitz mentioned, your opinion about physical activities. He had a question in the last slide. He would like to know your opinion about what kind of features are more important for you when it comes to utilizing outdoor spaces, and your opinion about outdoor physical activities. So please do feel free to share either through Facebook or send us an email and let us know. Our email is info@alzheimercalgary.ca. I also take this opportunity to encourage you to like and share this video if you found this beneficial, and also follow the Alzheimer Society of Calgary Facebook page for more videos in future. So that's all from us at this point of time. So have a great day.